There are two patients with heart failure. One struggles with breathing and the other has swollen feet and swollen hands. You might wonder, the same disease, why different symptoms? The difference in symptoms depends on which side of the heart is failing. In this video, you will finally understand the difference between left-sided and right-sided heart failure and the relationship between the two of them. The heart is made up of four chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. A key thing to note is that the right side handles the oxygenated blood and the left side deals with oxygenated blood. So the right atrium collects the oxygenated blood from the superior and inferior vena cava, pumps it into the right ventricle, which sends it to the lungs for oxygenation. The blood is returned back to the heart into the left atrium via the pulmonary vein. And this blood is pumped into the left ventricle, which pushes it into the rest of the body through the aorta. I have a video on this channel on blood flow through the heart. It might be very helpful for you to watch that video if you're struggling with blood flow through the heart. Now, this concept explains everything. When one side fails, blood backs up behind. So because the left side of the heart gets its blood from the lungs, if the left side fails, blood backs up into the lungs. Same thing with the right side, because it gets its blood from the veins, the two largest veins in the body, which collect blood from all other veins. Once the right side fails, blood backs up back into the superior and inferior vena cava and subsequently in the veins. Starting with the left-sided heart failure, remember that the left side deals with oxygenated blood. It collects it from the lungs and pumps it into the body through the aorta. Now in heart failure, in left-sided heart failure, the left ventricle cannot push all this blood into the aorta. It cannot pump this blood effectively into the aorta. As a result, the blood pulls up in the left ventricle, causing backflow into the lungs. Remember, the blood backs up behind the failing side of the heart. Once this blood backs up into the lungs, it increases the pressure in the lungs and the fluid shifts into the air sacs. Now, in the lungs, we have alveoli or air sacs where the actual gaseous exchange occurs. So the exchange of carbon dioxide and oxygen occur in the air sacs of the lungs. Normally, they are filled with air, but when this blood backs up and causes fluid to shift, the fluid moves into the air sacs. You would see that patient complaining of feeling like they're drowning, and that's because, when you're drowning, water moves into the lungs. That is exactly what happens, because what used to be filled with air is now filled with fluid. You would see the person struggling to breathe, which is called dyspnea. When the person lies flat, this struggle, the difficulty in breathing, gets more intense, and that is what is called autopnea. And it gets more intense because on lying down, gravity pushes more fluid into the lungs, causing even further congestion, and that is what causes that intense struggle when they lie down. There is also pulmonary edema. Another thing is, once you listen to that patient's chest with a stethoscope, the first thing you would hear is the presence of crackles. Once there is presence of crackles in the lungs, that tells you straight there is fluid in the lungs. And one key symptom of left-sided heart failure is the presence of fluid in the lungs. I hope you can see how the backflow of blood leads to these symptoms and signs being produced. Now let's discuss the right-sided heart failure. In right-sided heart failure, same thing happens. The right ventricle is unable to pump the blood into the lungs, causing fluid to pull up in the right ventricle and then backflow into the superior and inferior vena cava. This backflow raises the venous pressure and causes fluid to shift into the tissues. You see how in the lungs, fluid shifts into the air sac. When it comes to the body, fluid shifts into the tissues, and that is where you start to see the jugular vein will become distended. The peripheries, which are the hands and the legs, also become edematous or swollen, and that's because gravity pulls fluid downwards, and that's why these places are usually the first place to start swelling up. Another thing you would see is liver congestion. You might be wondering how these two are related. Well, here is the important clinical truth. Right-sided heart failure is always caused by left-sided heart failure. Once the left side fails, it causes failure of the right side as well. Here is how. So you remember, when the left side fails, it causes the lungs to become congested. It also increases the pressure in the lungs. Now the right side, which normally pumps blood to the lungs to get oxygenated, it now has to work twice as hard to overcome that pressure to be able to pump blood to the lungs. When this continues to happen over time, the right side, constantly being overworked, it starts to get weaker. And as it weakens, its pumping becomes ineffective. And that is what we call heart failure. So this is the disease process of how the right-sided heart failure occurs. So you can see the key differences between these two types of heart failure. Left-sided heart failure will cause congestion in the lungs. Right-sided heart failure will cause congestion in the body. Left-sided heart failure will cause pulmonary edema. Right-sided heart failure will cause peripheral edema, which is swelling of the hands and legs. Left-sided heart failure presents mostly with breathing difficulties, while right-sided heart failure presents with increase in venous pressure, which leads to one of the key signs of heart failure, which is jugular vein distension. If you take away nothing from this lesson today, remember that the left-sided goes to the lungs, while the right-sided is for the rest of the body. Remember this as well. Blood backs up to where it comes from, or you can also remember it this way: blood backs up behind the failing chamber. These two things, if you can remember it, you can talk about confidently about left-sided heart failure and right-sided heart failure. Let's look at some questions to test your knowledge of what we've learned today. The answers to these questions will be in the comment section below, so let me know if you got the answers to the questions right. If this helped you to understand the comparison between left-sided and right-sided heart failure, don't forget to subscribe for more step-by-step videos for more pathophysiology made simple. On this channel, we talk about anatomy, physiology, and pathophysiology, and I make it simpler for nursing students to understand it, for medical students, or if you're just a health professional who wants to know about what is going on in the body, well, you're welcome to my channel. If you have a topic that you're studying and you're struggling to understand and you would like me to help you with this topic, just comment it down below and I will pick it up and break it down for you. Thank you so much for watching this video with us today. Don't forget to subscribe so that you will get notified when another video is posted. Also, like and share this video to a fellow colleague who might want to understand the difference between left and right-sided heart failure. Check out the channel to see other videos that might be helpful to you as well. And I will see you in my next video.